everyone. Thank you for joining us today. Thank you for joining us in this community connect session. Topic Hore Tibi Sembuh, or in English, Hooray, TB is cure. It's a storybook about childhood TB management and TB preventive therapy. In this session, we will share one of our approach to raise awareness on childhood TB and to promote treatment of latent TB infection. So I'd like to introduce our presenters for today. We have Dr. Imran Prambudi, our NTP manager from Ministry of Republic of Indonesia, Ministry of Health of Republic of Indonesia, who also the advisor of the storybook. And we have Dr. Vini Fitriani as a pediatric respirologist from Indonesian Pediatric Society, who is also the editor of the storybook. And myself, my name is Trishanti Rondonungu. I'm the communication and knowledge management specialist from USA Tuberculosis Private Sector, and as the author of the storybook. So without further ado, I will start to share the screen, and we're going to have our presentation. Okay, from Dr. Imran. So, okay. Slideshow. Okay. Yep. And this is like the contents. So we have a 3 section. First session is childhood tuberculosis in Indonesia, presented by Dr. Imran Prambudi. And the second one, Dr. Vini will talk about the challenges in diagnosing and preventing TB in children. As for myself, I'm going to talk as a storybook as an entertaining modality to promote knowledge of childhood TB and TB prevention therapy. So please, Dr. Imran.
Yeah, thank you, Mbak Santi. So, good afternoon in Indonesia now, yeah, or maybe good night, good evening for all of the participants. So, greeting from Indonesia to all of you to attending the talk today. And I'm grateful that despite the COVID-19 pandemic, we can still talk virtually. It is more important than ever for us to strengthen and learn from each other to accelerate our effort in ending tuberculosis. I will share my reflection on how childhood TB in Indonesia. Slide, please. Yeah. TB is a major health problem in Indonesia. Each year, there are an estimated 845,000 new TB cases, and this ranked third in the world. And among other infectious diseases, TB remains the leading cause of death. Every year, there are 96,000 deaths due to TB, or maybe every hour there are about 10 deaths due to TB. Next, please. The number of TB cases in children continues to increase every year, and the need for TB drugs in children is always less. This shows that the prevalence of TB in children in Indonesia is quite high. It is estimated that child TB accounts for 11% of total TB incidence in Indonesia. This may be related to the high incidence of stunting also in Indonesia. Next, please. Yeah, Ministry of Health data shows the number of tuberculosis case finding in children were 56,000 cases up to 2019, or about 56% of the estimated incidence of tuberculosis cases in 2019. Tuberculosis notified cases in children under 15 years old showed an increase from 2016 to 2019. Nonetheless, the scope of tuberculosis detection and treatment in children under 15 years is still far below the global target of 90%. Next, please. These figures demonstrate a rising drug-resistant TB cases detection, with a widening gap between those diagnosed and those treated in Indonesia in recent years. And the number of children starting drug-resistant tuberculosis treatment tends to decrease during 2017 to 2019. In 2017, the coverage of children starting drug-resistant tuberculosis treatment reached 73%, and decreased respectively to 40% and then 33% in 2019. Next, please. So it has been estimated by the WHO that up to 1/3 of the world's population have latent tuberculosis. Up to 10% of people with latent TB eventually develop active TB years after the initial infection. Of every 10 people infected with Mycobacterium tuberculosis, one may develop an active infection sometimes in their lifetime. At present, there is no evidence of latent tuberculosis incidence rates at the national level. The estimated burden of latent tuberculosis cases was around 2.8 million people who came in contact with active tuberculosis cases. And research by Ministry of Law and Human Rights of Indonesia in 2017 showed the prevalence of latent TB infection among prisoners was 52%. And also the research in Yogyakarta estimated the prevalence of latent TB infection by 45% of all children who have contact with pulmonary tuberculosis cases with positive smear. And also health workers and students of the health profession are vulnerable groups to be infected with tuberculosis. Next, please. So in 2017, only 16% of HIV positive people were given tuberculosis prevention therapy. Only 8.5% of children under 5 years old who have a household contact history of a bacteriology confirmed tuberculosis case received tuberculosis prevention therapy in 2017. And the number of children under 5 years who receive preventive treatment with isoniazid reported in 2019 was only 5,350 cases. IPT coverage for children under 5 years was still very low compared to the national PPENH coverage target. IPT coverage was only around 2.1% in 2016 and was increased to 5.2%. And in 2019, it's increased around 9%. So it's still far below. And in 2017 and 7.7% in 2018 among the estimated children under the age of 5 who have a family contact history of bacteriologically confirmed tuberculosis case and receive IPT. However, in 2019, there was a decrease of the treatment of children under 5 years old who receive INH preventive therapy by only 5.5%. Among the estimated children under 5 years old were eligible to receive tuberculosis preventive therapy. I think that's all from presentation, and also this is the national strategy of tuberculosis care and prevention 2020 to 2024. So in our national strategy to elimination tuberculosis, so we put how we can improve the public knowledge about childhood TB. And also in the other strategy about how to optimize the promotion and prevention activities tuberculosis. So we put also here that we need activities that how to promote and prevent the activities through TB education of the community. Next, please. Yeah, I think that's all from my perspective about the condition of how childhood TB in Indonesia, and also how we can, how the strategy of to improve the status of childhood TB and also TB preventive therapy in Indonesia in 2020-2024. That's all. Thank you. That's all, Mbak Santi.
You have to unmute yourself, please.
Yeah, sorry, I forgot. Yeah. So Dr. Imran, if I might ask about the recent campaign about the about this childhood TB and also tuberculosis preventive. So I think NTP has done many campaign. Maybe you would like to elaborate on the campaign, the recent campaign during the Children's Day, Pak? Children's National Day.
Yeah, yeah. So we have several kind of campaign, yeah. But unfortunately, during
COVID,
yeah, we cannot do it off air. But we still have the campaign in online. One of the campaign is we develop a book with partners and also with the Pediatric Association about how we can educate the people, especially children, about knowing about the tuberculosis sign and symptom, and how to prevent and also how to cure or treat the TB. So in the early stage, we want to socialize, to disseminate information about the TB in the childhood. So that's why we developed a book, a very simple book, very colorful, and also fun to read. Fun to read to children. So our aim is to have education materials that easy to read and easy to understand to the children. That's the one of the campaign, Mbak Santi.
Thank you, Dr. Imran, for the nice presentation about the situation of childhood TB and also the TPT implementation in Indonesia. So I would like to continue with Dr. Fini. So Dr. Fini would like to discuss, present about the challenges in diagnosing and preventing TB in children. In her presentation, she will also share about her experience as a pediatrics in the both hospital and also in the private practice. Please, over to you, Dr. Fini. Thank you.
Okay. Thank you, Dr. Mbak Santi. Hello, everyone. This afternoon, I would like to share the presentation about the challenges in diagnosing and preventing childhood TB. I would like to share about the story from mother of child TB survivor. He is my patient in our hospital. 1-month-old baby with TB meningitis had hydrocephalus, recurrent seizure, positive tuberculin skin test, biliary appearance, and X-ray. And she hospitalized for 1.5 months and then discharged. Mother felt sad and regretted that she had used to give EINH to the baby when the grandmother has been diagnosed pulmonary tuberculosis by the doctor at the puskesmas for several months ago. She refused because the baby looked healthy and well. And the cute baby now is still alive after the meningitis TB, but along a hospitalization. She struggled to complete treatment and physiotherapy to try to optimize growth and development of the baby. The mother is still sad because the doctor told her that baby will have disability for his whole life. Next slide. This only one of the experience of our patient, but we have the many patients like this. And from the global data of burden, childhood TB and tuberculosis and TPT, we know that any child living in a setting where there are people with infectious TB can become ill with TB, even if they are vaccinated. Children with vulnerable immune system, such as very young, HIV infected, or severely malnourished, are most at risk of falling ill, dying from TB. And we know that today, WHO announced the estimate that 1.4 million children less than 15 years old got TB in 2019. And more than 8,000 children treated for MDR-TB in 2018 and 19 represented only 7.8% of the 5-year target. Slide. So it's very unexpected data. So this make have the many challenges of diagnosing childhood TB. From patient pathway, we know that in Indonesia, many people with TB initially seek care from a private provider, and 40% of TB patients are treated by private provider. And other study found that the 60% of parents had contacted their family doctor prior to visiting emergency department when their children have fever. And from health worker pathway, we know that not all the health workers have competence for the diagnosing TB. In many places, we still have the lack of screening methods like tools and facilities, and healthcare workers are not confident at diagnosing childhood TB. And we know that so difficult to prove confirmed TB in children. Slide. The other challenges is about TPT implementation. From my personal experience as pediatrician and consultant of pediatric respirologist, we know that sometimes other specialists still lack awareness of need for contact investigation of children contacts living with TB patients. More effort needed to educate parents to give TPT to children who look healthy. And we know that after we gave the children with TPT, the adherence to TPT is relatively high in pediatrician private practice compared with the TPT in puskesmas. We have the other health barrier from health worker. Sometimes health workers are often concerned about the development of resistance. So health worker acceptability difficult to convince parents of the benefit of TPT, and lack of confidence in giving TPT and dependent on doctor diagnosis instead of referring to sometimes symptom-based guidance. We have the guidance for this, but not all the health workers using this guidance. Slide. And we know that we have the barrier from parents too. Many parents confusion from about the children look healthy. The parent to the doctor or the health worker, my children looks healthy. Why should I give the NIH drugs? And what will happen if my children don't take the drug? Is it safe for the liver of the other organ? So this is need to much of effort, many effort to educate this parent like this. And we know that the parents have poor adherence to prophylactic treatment, especially knowledge and attitude toward TB disease and TPT. And parent acceptability have the low risk perception of TB disease. Sometimes the parents have influence from the friends, and the parents' lack of knowledge regarding of TPT. So the parents refuse for take the TPT for the children. Slide. In Indonesia, we have the cultural perspective too. One of our friend, that Dr. Trisa Silestari, have the research in about TPT implementation in Timika, Papua, that she found 1,500 adult case of TB lead to 10,000 pre-child contacts. In Papua local perception, sick is when call sick is when a child cannot be woken up. If they are malnourished or have other mild symptoms, they may not seek care. So this is can delay of TB care in the children. Just that TB symptoms like malnourished, mildly symptom should have the agreement by the father. The father is decision maker, and agreement for TPT depend on father education. Healthcare worker should have the struggle to contact the father. Slide. So I think this condition can be found in other provinces in Indonesia, but we still have the opportunity. First, we should engage key stakeholder in the community to address child tuberculosis and promote tuberculosis education and awareness, maybe in school and other community. And we should develop EIC materials, storybook, like the storybook for children. And we should have the school community to understand tuberculosis and its treatment to decrease the stigma associated with the disease. Contact investigation guidelines should be reviewed, and TB preventive therapy should be incorporated. Strengthen the capacity of health worker should be more improved, and we should expand coverage to children under 15 years old, not just under 5. And from this year, we have the new TPT drugs available, like 3-HP. I would like to give appreciate for the USAID to develop the storybook for children about TB, and I think this book can be used to promote the TB in children more effectively. It's all, Dr. Mbak Santi. That's all my presentation. Thank you.
Thank you, Dr. Fini. It is a very interesting presentations, and it's also nice to know for the point, your point of view as a practitioner, something as a pediatrics, and also just to know that there are really cultural barriers in healthcare, ya, Bu, ya, ya, dokter, ya. So, for example, like I just from this presentation, I just found out that the father is who's the one making decision in Papua. I thought mother will do that. I mean, mother is taking decision on their children's health. So
maybe different in my province, West Sumatra, mother more dominant because we have the matrilineal pattern. Yeah.
Okay. Yeah, same here. Dr. Imran, do you have any comments from Dr. Fini presentations?
Yeah, so the collaboration between NTP and also the organization profession and also the community with the support of the donors, I think it will be a more complete collaboration. Since you know that the TB problem cannot be solved only with the health approach, so it should be widened. We have to know how we can change the behavior of the people to be more healthy. That's my perspective, Pak Santi.
Yeah. Yes,
Would
I
you
agree,
like to respond on it? Yeah. Yes, please, Dr. Fini.
Yes, I agree with Pak Imran that we should make more collaboration with the other stakeholder, like maybe the school community is the potential community to next involved in TB.
Yeah. Okay. Thank you, Dr. Imran, for the comments, and Dr. Fini. I may have to continue with my presentations. It's about a storybook as an entertaining modality to promote knowledge of childhood TB. So why a storybook? Why not we're making like a game or other education materials or other medium? Because like a store for the first reason is because from the UNESCO report is nowadays, because of the digital disruptions, many children doesn't really read books anymore. But yeah, we also have this storybook in digital, so maybe we can. But then they try to use game more often than read books. So, and it's apparently that only one of our every 10,000 Indonesian children likes to read, only one, which is very, I mean, like very sad. But and thus Indonesian children's reading interest is extremely low. And from the report, it also mentioned that why the reading interest is low. It's because that they don't have much books to read, or the books that they don't have in the library. There's not so many books that is interest to them, like in color or in the cover or in the content. So thus we tried with NTP and also Indonesian Pediatric Society to develop this book as an awareness about childhood TB and tuberculosis preventive therapy, because as we already seen in a previous presentation, that still barrier in the knowledge and also the awareness on the childhood TB and TPT itself. So we really hope that this storybook will help to increase increase children interest and also parents awareness about the TB in children and also TBT. So what's in the storybook or the Hooray TB is Cure is an engaging tool to showcase the involvement of the private sector in TB care. As the Dr. Fini already mentioned, that like 70% of the patients go to the private sector, and for the mother, they tend to go to the family doctor before they went to hospital, or they prefer to go to the nearest health facilities. So in this book, we're trying to emphasize the role of private providers and also showcase the involvement of school, because in this character, we have TB as a children, as a boy who actually get TB and TB. So we want to portray that school can also involve in detecting children with TB or presumptive TB. They have a role to do that. So we would like to emphasize that on our storybook, and also describe the presenting signs and symptoms of TB in children, because many of the parents, correct me if I'm wrong, yeah, Dr. Fini and Dr. Imran, that many parents is not very aware that the children's have TB symptoms, because they thought the TB symptoms only cough, but there's plenty of other signs or other symptoms that can be prescribed as TB symptoms, and describe the recommended approach to diagnosis TB in children. So this is the book, and the book is available in the link and in the following link after this slide. So, but then we have the TB books in English. So we have the English version. So for those who wants to read this book, you can look after this slide. So what is the synopsis? The story is about 7-year-old TB is a happy boy who loves to play, and he loves to eat peanut butter sandwich during school break. So we call it selai kacang. And then, but yeah, lately TB has not been his usual self. He seems very tired, and his appetite has been on the low side. And one day at school, the teacher noticed TB's condition and called for TB's mother to pick him up from school. That's the role from the school, that they have to know about the student's conditions. So what happened to TB? Is he sick? What does the mothers need to do? Why does everyone in the house need to be tested? So this is why we want to emphasize the tuberculosis preventive therapy is not only for the children, but it's for the household context. So when will TB go back to school? So this is the role of the private, for the health facilities, how to determine the condition of this of TB, when he will get better, because he have to study, and what sort of consideration that he have to undergo for TB in order to go back to school. So yeah, and we, as Pa Imran, the NTP manager, mentioned about the campaign, so we conducted the storybook launching, virtual launching, using the webinar platform. So we worked with a storyteller from the Ayo Dongeng, team Ayo Dongeng Indonesia. So they actually perform a storytelling in front of like, I think it's like more than 200 participants at that time. And it's quite interesting, because it's the first time that I saw in virtual storytelling. And yeah, so this is the event that has been conducted in last July. And after the storytelling, we conducted a post-storytelling survey. So the participants is 215 participants from 215 respondents. So based on their feedback, so 50% 74% like the storybook because of the colorful illustrations. So yeah, that's what happened. I mean, like it's addressing the challenge that we have from the UNESCO report that the children don't really like the storybook because of it's not really engaging or interesting image. And also the 40% respondent said that they like the storybook because of the information and content. And the 6% say because it's different from existing storybooks. As at first, the storybooks is aimed to the children range from 7 years old above, but then we also want to confirm to our respondents to whom that they think the storybook is most suitable. So the answer is it is found that 83% think that the storybooks it's suitable to read along with parents. So it's not for the children itself, but the parents have to accompany the children when they're reading the book. And also it's suitable for to read along with teachers or caregiver. So you can read it at school for this book. And yeah, and the last one is 100% respondent. All respondents agree that they would recommend these books as a part of the books that for them to read, and also for the children's childhood TB promotion and TPT. Okay, as I mentioned earlier, this is the link to the Hooray TB Cure in English. So, and also if you have more, if you need more information regarding this book or regarding any presentation that we have presented today, please email me in this email address. And yeah, at last, maybe before I close, there's maybe some key messages from all the speakers, from Pa Imran and Dr. Fini, for key takeaway, key messages.
Yeah, thank you, Mbak Santi. I think what we have done in Indonesia about educate children is important one, since we should improve the knowledge of the children since the beginning of the life. And also during the elementary school, I think it's important to give them a basic how to take care of themselves, how to prevent the people getting sick of tuberculosis. And also I think this is in line with our strategy. We are in the process to make the presidential decree on tuberculosis. So in the presidential decree, we put also the importance of how we can educate people, how we can educate children in the school. So I think with this book, it will be more easy to understand about how we can prevent and treat the TB patient. That's my message. Thank you.
Thank you, Pak Imran. Dr. Tini?
Yeah. Okay, Nanti. I think this storybook children very well, so we can make this the other books like this. So because this book make our profession, health worker, doctor, and other TB program make more easier to educate the parent, to educate the children, and to increase the knowledge of the children from school to know about TB, and we can have the more survey for this. So I think we should make the other book about the other topic for TB, so we can improve our TB achievement. Thank you.
Thank you, Dr. Fini. So to end the session, I would like to thank our presenter, our speakers, Dr. Imran Prabudi from NTP Manager, and Dr. Fini Fitriani from the Indonesian Pediatric Society, and also for the USAID for the support, and of course Minister of Health and Indonesian Pediatric Society. Thank you.